Welcome to this course, which provides an orientation to the guidance on developing a national deployment and vaccination plan for COVID-19 vaccines. This module is about the preparation of the supply chain for the deployment of COVID-19 vaccine and the management of healthcare waste that will be generated by the COVID-19 immunization activities. By the end of this module, you should be able to describe critical supply chain activities to prepare for vaccine deployment and how to manage healthcare waste and access available tools and resources on supply chain and management of healthcare waste. The following are key elements for a successful COVID-19 vaccine deployment. The deployment plan and standard operating procedures must be well coordinated across all administrative levels and key personnel involved in the deployment operations. The supply chain and health staff should be adequate and well trained. The cold chain storage capacity is sufficient and surge capacity to fill any gap must be identified and in place. The supply chain system and infrastructure should be in good functioning order. The information management system is strengthened to achieve efficiency during deployment operation, and the oversight and management should be robust and data-driven. Finally, the resources from both internal and external sources are identified and secured. One important resource that complements the guidance for national deployment and vaccination plan is the COVID-19 vaccination supply and logistics guidance developed by the ACT Accelerator Collaboration. It provides detailed guidance to support countries in preparing deployment strategies, including practical options to address capacity gaps at different levels of the supply chain and safe management of healthcare waste. When preparing the supply chain for COVID-19 vaccine deployment, it is important to note that different vaccines require different storage temperatures. Most COVID-19 vaccines will be stored at positive 2 to 8 degrees centigrade. A few will require ultra-cold chain equipment with a capacity to store vaccines between negative 60 to negative 80 degrees centigrade, which also requires the use of phase change materials or dry ice for storage and transport. Heat-stable COVID-19 vaccines that can be used under a controlled temperature chain or CTC may also be available in the future. Therefore, preparing for deployment requires assessment of the supply chain capacity prior to vaccine introduction to identify and address gaps in terms of cold and dry storage capacities, distribution system, temperature monitoring, tracking and tracing vaccines, and reporting vaccine stocks and wastage rates. This exercise should include determining the available surge capacity from other government agencies and potential for outsourcing storage and transportation with experienced private sector companies. The result of this assessment should guide the development of the deployment plan. Outsourcing storage and transportation could be a more efficient and cost effective solution to address capacity gap, especially for managing ultra cold vaccines. By outsourcing, the workload is transferred to supply chain experts with experience in managing lean and agile systems. If outsourcing is used as a solution, strict independent monitoring procedures will be needed to guarantee vaccine quality, and the private sector companies should be involved in the planning phase for vaccine deployment. Supply chain human resource should be adequately prepared prior to vaccine deployment. All staff responsible for storing, handling, transporting, and tracking the COVID-19 vaccines should be briefed on the deployment plan and trained on relevant guidelines and standard operating procedures. The tools for assessing human resource capacity and identifying gaps are available in the ACT Accelerator COVID-19 Vaccination Supply and Logistics Guidance. The global supply of vaccine will be limited, especially in the initial stages of vaccine deployment, and this may result in a number of shipments of small amounts of vaccine over time. Countries' deployment strategy should include conducting an urgent assessment or reassessment of existing cold chain and supply chain capacity and of available surge capacity to ensure quality vaccines can be equitably delivered to the service points in the right place at the right time and in the right quantity. Mapping of cold and dry storage facilities, including potential sources of additional capacity from private sector sources, Estimating the relevant cost and facilitating rental agreements should be done in advance, and any gaps should be addressed prior to vaccine arrival in country. Forecasting vaccine and logistics needs and assessing available storage capacity are among the prerequisites to developing appropriate deployment strategies. This can be accomplished by using tools that are available from the WHO. The Immunization Supply Chain Sizing Tool provides information on equipment, supply, and budget requirements needed to support deployment and vaccination operations based on the size of the population to be vaccinated. The cold chain equipment inventory and gap analysis tool is useful in assessing vaccine volumes and corresponding cold chain capacity per catchment area. In addition, the following are also needed in developing deployment strategies. Identifying surge capacity. This means assessing and mapping all available cold chain capacities according to the projected temperature ranges required for storing the different COVID 19 vaccines. Preparing a distribution plan for vaccines and ancillary supplies based on the target population and number of staff involved in the vaccination activities. Reinforcing supply and stock management, especially since the initial COVID 19 vaccine supply will be scarce, with short shelf life and may not have VVM. And establishing a robust mechanism to ensure the traceability of the COVID 19 vaccines to avoid a risk of diversion and falsification. In the context of high demand but limited stocks, it is necessary to include a plan to safeguard the security of all concerned staff and all vaccine storage facilities, including during transit. Supply chain managers are encouraged to familiarize themselves with the tools for scenario analysis and microplanning in order to be able to simulate the impact of the different vaccine deployment scenarios on human resources, logistics, and budgets. Since many different types of vaccines are under development and several tests are still ongoing to provide full information on vaccine profiles, it is encouraged to regularly check for the latest information about the allocated vaccine and to revisit and adjust the deployment plan accordingly. To make the vaccine effective in controlling COVID-19 pandemic, speedy distribution of the vaccine at service points is critical. This can be achieved in an efficient supply chain system. The following will facilitate supply chain efficiency. Staff are trained and can demonstrate ability to perform tasks according to standard protocols. Policies, guidelines, and SOPs are clearly written, updated based on vaccine profiles, and disseminated to concerned parties through a variety of channels, including mobile communication. Operational tools, including those required for recording, reporting, and monitoring, are available and accessible. Warehousing infrastructure is designed to ensure safe and smooth operations during vaccine handling. The cold chain inventory is updated, storage and transport capacity are adequate, equipment is functional and maintained, and systematic temperature monitoring is in place. Sustained power supply, including backup generators, are available in the facilities. Security measures are in place to prevent theft of vaccine during storage and transport. Communication channels are clearly defined, including reporting requirements for issues needing urgent attention. A robust supply chain information management system is operational and data are available to those in need. Contingency and maintenance plans are clearly written and communicated to the responsible personnel. The operational budget is sufficient, secured, and made available to supply chain or facility managers in good time. The role of the private sector is well documented, and oversight is provided to ensure adherence to standard operating procedures, and supply chain activities foster innovation and partnership. Some COVID 19 vaccines may not be pre qualified at the time of the initial delivery. They will be used under the VRICH's Emergency Use Listing or EUL procedures. It is possible that some vaccine profile, such as the VVM type and expiration date, will not be established by the time they are labeled for use. Most vaccine may come with date of manufacture in lieu of the expiration date. Therefore, strict compliance with the standard protocols for storage, handling, supply distribution, transportation, and logistics procedures and practices is critical throughout the deployment period. Proper recording and reporting of vaccine batches or lots is also important for monitoring and investigation of adverse event following immunization or AEFI or adverse event of special interest or AESI. AESI are a predefined list of AFI that need to be specially evaluated given what is currently known about the safety risk of COVID-19 vaccines. Some COVID-19 vaccines may come with a barcode or QR code attached on the secondary and tertiary packaging containers. The barcode facilitates efficient tracking of the vaccine and reduces the risk of falsified vaccine entering the supply chain. Where feasible, steps should be taken to improve the supply chain management system to facilitate track and trace capability, and a plan to ensure security and authenticity of supply chain is critical. Some vaccine profile information, such as heat stability and shelf life, will be shared when it becomes available. The QR code may be used to rapidly inform countries and health workers on any new information. Countries should consider this possibility when developing guidance, conducting training, and strengthening their supply chain information management systems. Given the limited supply, countries should carefully monitor vaccine usage and wastage rates. These information are useful to guide forecasting for the succeeding phases of the vaccine deployment and improving management of COVID-19 vaccination. It is projected that most COVID-19 vaccines will be stored at positive 2 to 8 degrees centigrade. Few will require ultra-cold chain. Countries receiving vaccine requiring ultra-cold chain should adjust their plan to ensure vaccine is safely stored, transported, and managed up to the service points. To determine readiness to accept this type of vaccine, countries should demonstrate the following prior to vaccine arrival. Cold chain capacity for negative 70 degrees centigrades and dry ice production capacity are mapped. UCC hubs at the national and subnational levels are established. Continuous temperature monitoring system is in place. Technical support for installation and maintenance of UCC equipment is available. Power supply and standby generators are available. Specialized containers for vaccine transport are adequate. Contingency plan is in place and tested, and concerned personnel are trained and equipped with appropriate personal protective equipment. COVID-19 vaccines requiring ultra-cold chain would pose several challenges for many low and middle-income countries, such as lack of existing ultra-cold chain equipment, including capacity to produce PCM or dry ice within the health or immunization systems. Huge investment cost considering the time-limited nature of the need for ultra-cold chain capacity, and complicated handling and distribution requirements, particularly if the vaccine has limited stability when stored at positive 2 to 8 degrees centigrade. Given these challenges, countries should explore practical solutions such as utilizing established internal and external resources, commissioning logistics service providers that can deploy the required ultra cold chain capacity and transportation, including facilitation of reverse logistics, can be considered. However, countries should first carefully weigh their option vis-a-vis the capacity of a third party to deliver within a short lead time, ideally less than 3 to 4 months, versus the time frame when vaccine that can be stored at positive 2 to 8 degrees centigrade will be available. There could be other alternatives, and in the context of COVID-19, the cost competitive option is the one that can demonstrate strong responsiveness to government's accountability and service delivery needs. Managing reverse logistics should be included in the deployment plan. In the context of COVID-19 vaccine, reverse logistics means retrieving unused vaccine for reallocation, recall, or disposal. Unused vials without PVM or expiration dates must be returned to higher store levels for proper management. To accurately measure vaccine usage and wastage rates, all vaccine vials must be accounted for in vaccine stores and service points. Managing waste related to COVID-19 vaccination requires special attention due to the infectious nature of the virus and the potential higher volume of healthcare waste due to the mandatory use of disposable and reusable personal protective equipment and other hazardous materials. To minimize the risk to the communities, health workers should practice on site waste segregation and implement reverse logistics, where healthcare waste is taken back to the facility by the vaccination team to be disposed of properly along with other hazardous waste. A costed waste management plan must be developed with budget for training and employment of waste handlers, including provision of waste containers and treatment technologies, and possible outsourcing to the private sector services for waste treatment and disposal. This slide summarizes the list of information describing the status and management of the immunization supply chain, including gaps and solutions to address them. These information are crucial for identifying appropriate supply chain strategies to successfully deploy COVID-19 vaccine. This list is found in Annex 1 of the Guidance for Developing the National Deployment and Vaccination Plan. In addition to information related to supply chain management, Annex 1 also lists the crucial information needed to plan for safe management and disposal of healthcare waste. The take home messages are as follows. COVID 19 vaccination supply and logistics guidance can support countries to prepare for deployment. Supply chain readiness is critical to vaccine deployment. Cold chain requirement will vary by vaccine. There will be limited supply of vaccines with potentially shorter shelf life and no VVMs. Strong information management systems are required. Security for vaccine storage facilities and personnel is important. Updated assessment of cold chain capacities is required. Existing supply chain should be adapted to current context. Training of staff is critical. Tracking of vaccine is key. Careful consideration is required before accepting vaccine that needs ultra low storage temperature. And management and treatment of healthcare waste requires special attention in the context of COVID 19. You have reached the end of Module 7. In summary, the National Deployment and Vaccination Plan should include strategies to prepare the supply chain, strengthen supply chain human resource capacity, assess storage and transport capacity needs, ensure supply chain systems functionality, manage and track vaccines, prepare ultra low storage capacity as needed, and manage reverse logistics and healthcare waste. Here are the links to some useful resources on supply chain and healthcare waste management.